Today we're going to attempt something that's never been done on social media. We're going to talk about reversal of plaque, reversal of heart disease, but not based on stories, not based on theories. We're going to look directly at the highest level of scientific evidence, randomized controlled trials in human beings, and we're not going to cherry pick. We're going to look at all of them. There are 6 randomized trials in humans, changing diets and claiming some degree of plaque reduction, reversal of heart disease. Most of these have never been broken down on social media, are never discussed, are never shown to the public. We're going to change that right here, right now. I went over these 6 trials. I'm going to show you the key takeaways, the key features of each one, and then we're going to try to piece together the ideal diet to reverse heart disease based on this body of evidence. Make sense? Let's get into it. So the first trial on our list is the one you've probably heard of. Lifestyle Heart Trial, published in 1990, 34 years ago. 20 men with documented plaque in their arteries finished the entire diet intervention, and they had a control group of about the same size that did not get the lifestyle intervention, just got the usual medical care. So the diet consisted of a low-fat vegetarian diet, fruits and vegetables, whole grains, legumes, soy products, egg white, 1 cup a day of no-fat milk or yogurt, and otherwise low in alcohol, no caffeine, and they did get a B12 supplement. About 8% of their calories came from fat, most of which was unsaturated, about 15% of their calories from protein, and about 76% from carbs. So it's clearly a low-fat, high-carb diet. Dietary cholesterol, they only got about 18 milligrams per day, very low. That corresponds to about 1/10 of the cholesterol in 1 egg. In total, they were getting a little under 2,000 calories a day. Now, very important, they also received an exercise program. Moderate aerobic exercise, mostly walking on treadmill, at least 3 hours a week. Stress management training, 1 hour a day, stretching, meditation, breathing techniques, etc. They were asked to quit smoking, the ones that smoked, and the investigators ran blood checks to make sure they did. And finally, they had a group social support session twice a week. So it was a pretty intensive, multi-pronged intervention. This is important. We'll come back to this. And so the intervention group, getting this whole lifestyle intervention, they lost weight, their cholesterol dropped, all these things that you'd expect from an intervention that tunes up your diet and exercise. They were followed for a total of 5 years, and the technique they used to measure the plaque was angiography. Basically, you inject contrast into the participant's bloodstream and you take an x-ray. And so the contrast running through the bloodstream allows you to see the outline of the blood vessels. So if there's plaque growing and pushing into the artery, you'll see a narrowing, like the artery is pinched. So angiography is a great technique, very useful. Now, there are some caveats to angiography, like every technique ever. For example, plaque that grows in the wall of the artery but doesn't push into the artery, into the channel where the blood flows, we can't see that. The outline of the inside of the blood vessel looks the same. Second, if the plaque does push into the artery and narrows blood flow, sometimes the artery will dilate to compensate for the narrowing. So the outline of the inside of the artery looks wider because it dilated. So we might think the plaque shrunk, even if it didn't, even if it grew more. So grain of salt with angiography. The results of the Lifestyle Heart Trial at the 1-year time point, 82% of participants had a change in their plaque size in the direction of reversal, although it's not clear how many were statistically significant. And then at the 5-year time point, the end of the trial, the overall average was a 3% reduction in stenosis. So stenosis is the pinching of the artery. So about 3% of that space, that hollow tube the blood runs through, got unclogged. Average of all the participants receiving the lifestyle intervention. And this effect was stronger in the people who complied the most to the recommendations, to the program, and weakest, the effect was smallest in the participants who complied the least. Now, 3% might sound tiny, but this is in the range of these trials that we see with medication, with exercise, with diet, usually in the single digit. So it is hard to undo a large chunk of plaque once it's formed. But bear in mind that even a small reduction in stenosis and plaque can increase blood flow by a lot. This has to do with the laws of fluid dynamics. And so even a 1% reduction in plaque can have a strong clinical impact, as we'll see in a second. So a reduction of 3%, given everything we know nowadays, is actually fairly impressive. All right, last thing we're going to look at with this trial before we can move on to the second trial is events. Events means actual heart attacks, strokes. So these actual outcomes that ultimately are what we really care about. Yes, the size of the plaque matters, but we have to bear in mind rupture of plaque that usually leads to heart attacks and strokes often does not happen in the largest segments of plaque, in the thickest plaques. So whenever possible, we want to look at actual events. That's the bottom line. So with events, large reduction, 60% fewer events compared to the control group. So bottom line, this trial was a landmark at the time, very encouraging results. We have to be careful not to overstate lifestyle heart trial because of all the limitations that we talked about. The size, it's a small trial, 20 participants on the intervention by the end. Also, we can't say that the benefits came from the diet because there are so many changes, so many components. The issues with the technique, with the angiography, we've talked about that. And also all of the completers, all of the ones that went all the way to the end of the 5 years were men. We're going to go on to the second trial on our list, and that's the STARS trial. Published in '92, 26 men with a history of heart attack or chest pain with high cholesterol were put on the diet intervention. Then they had a control group of about the same size who just got usual medical care, and a third group who got both the diet and lipid-lowering medication. So a double intervention. The diet was 27% of calories coming from fat, where saturated fat was about 8 to 10% of their calories. Polyunsaturated fats were about 8%, and dietary cholesterol was about 200 milligrams a day, a little over 1 egg, and they also had an increase in fiber compared to their normal diet before the trial. Total follow-up was a little over 3 years. They also used angiography as the technique, and so results, average reduction in stenosis of about 1% in the diet group, although it did not reach statistical significance, and then 1.9% in the diet plus medication group, and that one was significant. In terms of actual events and symptoms, both angina and events were reduced significantly on both of the intervention groups, the diet and the diet plus meds. The events were reduced very impressively, a 70% reduction on the diet and a 90% reduction on the diet plus meds. Although we have to be very careful because the numbers here are very small. It's like 10 events in the control, 3 events on the diet, and 1 event on diet plus medication. So tiny numbers, big grain of salt. So this trial, the STARS trial, shares some of the limitations of the lifestyle heart trial. The size, it's also a small trial. Technique is the same. And the gender, they're all men again. The strength, the claim to fame of the STARS trial is that it used diet alone. So for the first time in a randomized trial, it showed that diet per se can reduce symptoms and even events, although the effect on plaque size did not reach statistical significance. All right, we're going to move on to the third trial. Just bear in mind that there are other studies out there looking at diet and plaque that are not randomized. We're focusing on randomized trials because they're a higher level of evidence, and we have a few of them, quite a few. But there's other studies out there, for example, the work of Dr. Caldwell Esselstyn. People often ask about that. He has a couple of case series published documenting the observations with his patients, and we actually interviewed him at length, so you can check out that whole interview. I'll link that at the end of the video, and I'll put that in the description as well. Okay, so the third trial on our list is the SCRIP trial, published in 1994. 118 participants finished the intervention, so it's the largest trial so far. Not all men this time, but about 80% men. Unfortunately, this is a pretty common bias in cardiovascular research, in part because the men tend to be sicker. Another group of about the same size were the controls and got usual medical care. So the intervention was a diet that was 24% of calories from fat, 7% was saturated fat, 140 milligrams of dietary cholesterol a day, so a bit less than an egg. But they also had an exercise component. The investigators were encouraging them to lose weight, to not smoke. There were also medications with the goal to improve their blood work, cholesterol, triglycerides, glucose, blood pressure. So very much a multi-pronged program. They were followed for a total of 4 years. This trial also used angiography. These 3 trials were published around the same time, so they all used the same technique. In the end, they reported reversal of plaque in 20% of participants, although the overall average was not reversal. The average of all the participants was still progression, growth of plaque, but just slower than the controls. So it slowed down their plaque growth. Events, there was no significant difference overall. There was a trend in the last 2 years of the trial, a very significant reduction of events in the group receiving the intervention, like 5 or 6 times less events than in the controls. But because this difference was only seen in those last 2 years, Overall, it didn't reach statistical significance. So in general, this trial feels like a bit of a disappointment, right? Because it's larger and has all these different prongs, this multifaceted intervention. So you kind of expect a big result. And yeah, things moved in the same direction, but less strongly than in the previous two trials. And the diet is very similar to the STARS trial, so that's unlikely to be the explanation. One possibility to explain this difference is in this trial, they excluded participants who had a lot of clogging, very extensive plaque. So plaque that blocked 70% or more of the space in the artery were excluded because those patients often need interventions like revascularization. So to avoid that skewing the trial, they decided to leave them out in the first place. And it's precisely those larger plaques that usually where we see the strongest reductions. So maybe this is why their results with plaque were a little disappointing. Other than that, the caveats of this trial are the technique, just like the other two, and the fact that it's a multi-pronged intervention. So we covered that. All right, let's look at the last three trials, and these are a lot more recent. So number 4 on our list is PREDIMED, which was published in 2013. 103 participants with risk factors for heart disease like diabetes. And here the majority were actually women, were put on a Mediterranean diet. Half of them were on a Mediterranean diet with extra olive oil. The other half, Mediterranean diet with extra nuts. And another 60 or so participants, they received advice to reduce fat in their diet, and actually ended up being a very modest fat reduction. The follow-up was 2.4 years, and the technique was not angiography, it was ultrasound of the carotid. So carotids are the arteries that take blood up to the brain. So ultrasound shows not just the outline of the inside of the vessel like angiography, but also shows us the wall of the artery. And this actually allows us to measure the thickness of the artery wall. So their results as far as plaque, the average wall thickness was reduced in the main artery they were interested in, but only in the Mediterranean diet with extra nuts. In the Mediterranean diet with olive oil, it neither grew nor shrunk. And then two other arterial territories, there was no significant difference on either Mediterranean diet. So it's possible that the diet with extra nuts was a little better at reducing plaque, at least in that one territory. This would be interesting because when we look at actual events, they're reduced on both Mediterranean diets and by about the same margin. 31% less events on the Mediterranean diet with extra olive oil, 28% on the Mediterranean with extra nuts. No significant difference between them, so about a similar reduction in both. And then when looking at the most compliant participants, 58% reduction in events, average of both Mediterranean diets. One thing to bear in mind is these individuals that had their plaque measured were a very small subset of PREDIMED. PREDIMED had over 7,000 participants, and the events results account for all of that, but only about 100 people, give or take, had their plaque measured. So it's a very small subset. It's possible that it's not representative of the larger group. Possibility. And the short duration of the trial is also a caveat to bear in mind. All right, let's look at the last two trials on the list. Number 5 is CORDIOPREV. Almost 400 participants, 80% men, with diagnosed heart disease, so the largest trial on our list. Also put on a Mediterranean diet, 40% of calories coming from fat, mostly unsaturated fats. Saturated fat was less than 10% of their calories, high in olive oil, and as usual, a control group about the same size who just received advice to lower fat. And they ended up eating about 32% of their calories from fat. So not a big difference in fat intake between the two groups. The folks on the Mediterranean diet consumed more olive oil, more nuts, more fatty fish, and a bit more fruits and vegetables than the control group. Total follow-up was 7 years, so this is both the largest and the longest trial on our list and the largest trial ever to test this question. And this trial also used ultrasound of the carotid. Basically, artery wall thickness was reduced on the Mediterranean diet by about 13%, and the maximum plaque height was also significantly reduced. This is interesting because in this trial, they ended up eating about the same amount of olive oil as they did in PREDIMED on the high olive oil group, right? And yet here, we see a significant reduction in plaque size. Why? One possibility is the patients in CORDIOPREV are higher risk. So maybe they have more plaque, and that's why it's easier to see the reduction. It's one possibility. Or maybe because of the gender difference. In terms of actual events, a 28% reduction on the Mediterranean diet overall, and a 40% reduction when looking at highest adherence. One limitation, as we already said, is in CORDIOPREV, the patients were high risk with a history of heart attacks or unstable angina. And now the last trial on the list is the DISCO trial. 45 participants, about a third of which were females, were put on a DASH diet. And as always, a control group about the same size on usual care, which by now, the 2020s, includes lipid-lowering medication. So DASH stands for Dietary Approaches to Stop Hypertension, and it's similar to a Mediterranean diet with a focus on high potassium and low sodium foods to lower blood pressure. So basically, fruits and vegetables, whole grains, low-fat dairy, low in saturated fat, low in dietary cholesterol, low in refined grains. About 30% of their calories from fat, 50 to 55 from carb, and 16 to 18 from protein. And they did also receive advice to exercise in this trial, so a bi-pronged trial, if you will. Total follow-up was a little over 1 year, so this is the shortest follow-up on our list. On the other hand, they had the fanciest technique, CTA, computed tomography angiography. It's basically an angiography like we saw with a contrast through the bloodstream, and then instead of an X-ray, you do a CAT scan. So this allows us to see not just the size of the plaque, but also the composition of the plaque. Is it calcified? Is it soft plaque? And this is even more important than sheer size. So results of the DISCO trial, very interesting. Overall plaque volume, no significant change between the two groups. But when they looked only at the soft plaque, the non-calcified plaque, it came down in both, reduced in both groups, but more strongly on the intervention group receiving the DASH diet and the exercise. Why does it also come down in the control group? Possibly because of the meds. Those have been shown to reduce plaque by themselves. And so we're seeing an additive effect of the lifestyle, the diet, and the exercise on top of the usual care with medication. And then when we look at the other types of plaque, fibrous plaque, calcified plaque, those actually increase. So what we're seeing is there isn't much of a difference in overall plaque size, but there's a shift from soft plaque, which is more vulnerable, to fibrous and calcified plaque, which is more stable. And there were no events on either group. This trial is not really powered for events. It's very short. So main limitations of the DISCO trial, small number of patients, short trial, two-pronged, so we can't say that the benefits are just the diet, and no information about events. All right, so we covered the 6 trials. 3 are just diet interventions, and that was STARS, PREDIMED, and CORDIOPREV. The other 3 are multi-pronged, more than one change. So basically, we see encouraging results, benefits on some lower fat diets, some diets that are not so low fat, some Mediterranean diets, some DASH diets. The temptation is to compare these trials head to head and come up with the winner, right? That's very difficult, very tricky to do because they use completely different techniques to measure plaque. It's separated by decades. The populations they look at are different. Some trials are really small, so we have to do grain of salt. So here's what I would do. If it was my arteries on the line, right, or a loved one, I would forget about these labels, these diet names, and I would look at the commonalities. What are the common themes of all the interventions that work? What are the foods that every one of the 6 trials has? Fruits and vegetables, legumes, whole grains, some dairy like yogurt or milk. Sometimes it's low fat, sometimes it's not. So these are the foods I would favor. We can't tell which foods exactly are delivering the benefits because the trials change the entire dietary patterns. So that's another reason to look at commonalities. And then foods that are present in some trials, not all. Healthy fats, nuts, olive oil, fish and seafood, eggs, white meats. We see benefits with diets including these foods. We see benefits with diets not including these foods. So it's personal preference. Now, if somebody wants to favor nuts over olive oil because of that result with PREDIMED, I don't see a problem with that. It's not the strongest scientific argument. As we saw, the same amount of olive oil reduced plaque in CORDIOPREV, and there were some inconsistencies there with the PREDIMED result. But at the level of personal preference, if someone prefers nuts over olive oil, I don't see a problem. And finally, foods that all of the trials limit: junk food, refined grains, cookies, cakes, sugary cereal, sugary soda, Pop-Tarts, potato chips, large amounts of butter, large amounts of fatty meats, large amounts of alcohol, not present, actively avoided in all of these trials. So I would limit these foods. Is it possible that research in the future is going to add more details or change our understanding? Always a possibility in science. Today, with the science we have, if it was my arteries on the line or a loved one, this is what I would do. Would I settle for that diet? Absolutely not. I would do all the other components too. I would do the exercise. I would stop smoking. I would do the stress management. And I would medicate if I had a lot of plaque or a history of heart attack or a high calcium score. We have very strong evidence that medication in people who have risk lowers plaque and lowers events, heart attacks and strokes and death. So if it was my arteries, I wouldn't play any games. Maybe your conclusion is different from mine looking at the evidence. That's perfectly fine. In fact, let me know below what you agree or disagree with. The important thing is you now have access to the information so that you can make your own educated choice. Science hinges on evidence. It doesn't hinge on stories. So if somebody's telling you a story about how to reverse your heart disease and not showing you these 6 randomized trials in humans spanning 30 years, ask them why. Ask them why they're not showing you the evidence. Demand better content and vote with your clicks. How about exercise? Can exercise reduce plaque? We actually covered that in a previous video. You can check that out by clicking right here. And here's the full interview with Dr. Esselstyn covering his work in reversal of heart disease. Check those out. I'll meet you over there.